month's podcast features Dr. Michelle Holmes, an associate professor of medicine at Harvard Medical School and an associate professor of epidemiology at Harvard School of Public Health, as she discusses how widespread vaccination for COVID-19 will have a positive effect on school openings in the fall. Dr. Holmes also addresses many questions on the minds of students, parents, and teachers, including how the vaccine works.
So it contains a small piece of genetic material which codes for the COVID-19 spike protein. And I'm sure you remember seeing pictures of the COVID-19 germ. It looks like a ball with all these spikes sticking out of it. Those are the spike proteins. So the vaccine does not contain the whole virus, and it doesn't even contain a code for the whole virus, just for the spike protein. So that spike protein, that genetic material enters your body and instructs your cells to make spike proteins. Not the whole virus, just that protein.
Why it is so important teenagers receive the vaccine now that they're eligible.
And it's important to know that just recently the CDC has noted that hospitalizations for severe COVID among teens is up. Now that most old folks are vaccinated, the people in the hospitals are young people and teens and very severe in the ICU. And the CDC is urging families to vaccinate their teens, and I urge the same.
And the issue of inequities and disparities of the vaccination process, especially in the early days of vaccination availability.
Systemic racism has worked in many insidious ways to obstruct access to the vaccine and to testing before that. So early on for the vaccine, you needed a good computer system, you needed internet, you needed a lot of free time to make an appointment, you needed a decent car to drive out to the mass vaccination site. You needed the kind of job that would give you the time off to go get your vaccine. You needed to not be scared of the National Guard troops in their uniforms giving out the vaccine. You needed to feel that the place where the vaccine was being given was a comfortable place for people like you. You would want to see people who look like you there. And some of the obstacles are decreasing now because there's been more emphasis on community-based vaccination sites, sponsored by pharmacies and clinics and churches, and even being promoted in places like hairdressers and barbershops. So I'm hopeful that these disparities can decrease over time.
Dr. Holmes is a graduate of Harvard School of Public Health, Harvard Medical School, earned a PhD in Public Health Epidemiology from Harvard School of Public Health, and has over 39 years of experience in the field. Dr. Holmes is currently an associate professor of medicine at Harvard Medical School, an associate professor of epidemiology at Harvard School of Public Health, and is the author of numerous studies and journal articles. She is the co-creator and co-principal investigator of the Africa HSPH Partnership for Cohort Research and Training Project, designed to study and prevent chronic disease, especially in women, across Nigeria, South Africa, Uganda, and Tanzania. This podcast was created by JFY Networks, a Boston-based nonprofit provider of online learning programs to schools, students, and parents. JFY's focus includes individualized, self-paced curricula to help raise individual and school performance measures by maintaining grade-level skills and combating learning loss. JFY provides online ELA and math curricula aligned to state and college standards from grade 5 through high school, with personal support online and via phone from professional learning specialists like yours truly. For JFY Networks, I'm Greg Cunningham. As the academic school year comes to a close, many have begun to focus on what our schools will look like come fall. We recently spoke to Dr. Holmes about how access to the COVID-19 coronavirus vaccines may help create much more normal school sessions next year. She began by explaining how the vaccines work in our bodies.
So I'm going to focus on the vaccine that's approved for teenagers, and that's the Pfizer vaccine. The Moderna vaccine works essentially the same way. The Johnson & Johnson vaccine is a little different, and I can talk more about that later. But the Pfizer vaccine, which is approved for adolescents, it uses the messenger RNA technology, which is this is the first vaccine that has been used in, although it's been studied for decades. So it's not really as new as people think it is. So it contains a small piece of genetic material which codes for the COVID-19 spike protein. And I'm sure you remember seeing pictures of the COVID-19 germ. It looks like a ball with all these spikes sticking out of it. Those are the spike proteins. So the vaccine does not contain the whole virus, and it doesn't even contain a code for the whole virus, just for the spike protein. So that spike protein, that genetic material enters your body and instructs your cells to make spike proteins. Not the whole virus, just that protein. And then the genetic material that was injected is very unstable, and it's destroyed by the body very quickly. The spike proteins are now floating through your body alone with no COVID virus attached to it. And the body recognizes this protein as foreign, and the immune system destroys it by disintegrating it. Now, the immune system has a memory. So after vaccination, if your body sees a COVID virus with its spike proteins in the future, your immune system will destroy the protein and the COVID virus along with it. That's how it works.
So you said that the Moderna works in a similar way, but the Johnson.
The Moderna is almost exactly the same. It's just a different brand. Johnson & Johnson uses an older technology that other vaccines have used, which uses basically a harmless virus to deliver to you the spike protein.
So in a more traditional vaccination.
It's a more traditional vaccine, yes.
So in your opinion, do you think that these vaccines, especially the Pfizer, which has already been approved, is safe for children who are 12 and older?
Yeah, the Pfizer vaccine was tested in more than 2,000 adolescents, and not a single vaccinated kid got COVID, meaning that it was 100% effective. And in those kids that were tested, there was no serious side effects. And so it was concluded to be safe. Now, you do the trials in several thousand people, but then we give it to millions of people. And sometimes side effects that are rarer than would show up in a few thousand can show up in those millions. So people may have heard that there have been a very few cases of heart inflammation that have been reported in young men, particularly in Israel. Israel's done a lot of vaccination. And so the CDC is watching closely to see if this happens in a U.S. youth and young adults. This heart inflammation is like really rare, and those people that have gotten it has gotten better with treatment and rest. So it should not stop you from getting the vaccine. And it's important to know that just recently the CDC has noted that hospitalizations for severe COVID among teens is up. Now that most old folks are vaccinated, the people in the hospitals are young people and teens and very severe in the ICU. And the CDC is urging families to vaccinate their teens, and I urge the same.
And what do you think the prospects are for vaccinating children under 12?
Oh, that's being tested right now, and we were hoping for results and approval by the beginning of 2022, and it may be even sooner. It would be nice if it happened before school opened. I'm not sure that they can do it that fast.
Do children receive the same dosage as adults?
Yeah, right now, everyone age 12 and up gets the same dose. I think the thinking is that kids are pretty close to their adult size by that age. It is possible that the younger children and babies may get smaller doses, and we'll learn that when the trials are over, if it's better to use smaller doses with them.
So are the vaccinations, do you think that the best shot that we have of getting middle schools and high schools back to what would look like normal in the fall?
Well, it looks like that public officials are pretty intent on everyone going back to school as normal in the fall, regardless of whether you are vaccinated or not. So I would say if you are eligible. Getting vaccinated is the best way for you to keep yourself safe, your family safe, and your community safe.
And what about wearing masks in schools? Should students who are not vaccinated be wearing masks? Should elementary school?
Well, right now, the CDC, yes, the CDC recommends that unvaccinated people continue to wear masks, particularly in indoor spaces and where there'll be lots of people, and particularly around other unvaccinated people. So that would include unvaccinated children of any age. Unvaccinated children can probably safely go without masks. With vaccinated people in small groups, like meeting their grandparents, they can probably safely go outside without masks if they're distance. Personally, I think it's a little trickier about playing outdoors with other unvaccinated kids because it's pretty hard for them to maintain distance, and it might be safer to be masked. And right now, masks are recommended by the CDC in school for everyone, vaccinated or not. However, they are considering lifting the masking recommendation for the fall. And if they do lift it, the thinking will revolve around three facts. One, if COVID rates in the community are low. Two, if enough adults and teens have gotten vaccinated that they think it will keep the rates low. And three, the fact that elementary school kids, aged kids who as yet can't get vaccinated, the COVID disease is usually not very severe. However, I think it's really important to be mindful of the equity issues here, because although COVID is not usually severe in the very young children, those young children who have died from COVID have been disproportionately Black and brown.
Now, what about adults who are vaccinated? Should they be wearing masks anywhere at this point, or are they?
Well, right now, that's the CDC guidelines that everyone in school should wear masks regardless if they're vaccinated. However, some local school departments around the country have lifted the mandate to wear masks. I mean, the science shows that universal masking kept rates low in school.
So it makes sense to keep wearing the mask.
I think it makes sense at the moment. And when the masking mandate is lifted, it will depend on those factors I mentioned before: the rates in the community, the variants in the community, whether enough people have been vaccinated, etc.
And what about things like extracurricular activities, sporting events, drama clubs, performing on stage in a chorus or a band, and not having to wear masks? Is that something that can be safely done, or are we?
Oh, yeah. There's some pretty complex rules for this that I ended up, reading through. So right now, masking and physical distancing is still recommended for indoor sports, but outdoor sports that can be appropriately distanced can be unmasked. Now, singing and wind and brass instruments and vocalizing during drama performances are pretty high-risk activities, and these should be mask distance and outdoors if possible. However, I think there's really hope for extracurricular activities. Some normalcy can come in settings where vaccination is universal. And I'm aware that some summer camps are requiring all campers and staff to be vaccinated, and those teenagers can have a pretty normal, unmasked summer experience. So that's something to look forward to.
We know that both the Moderna and Pfizer have provisional approval, and they've applied for FDA full approval. About how long will it be before the FDA says, yes, these are fully approved, it's not provisional anymore?
Yeah, it normally takes several months to a year, but these aren't normal times. And given a global emergency, I'm going to guess it'll be closer to the months rather than a full year.
And what about booster shots? Are we looking at those just like we do for the flu shot every year?
We don't know yet, and it is entirely possible. It depends on two things: how long the immunity from the first vaccination lasts, and we just don't know that right now. We know it lasts at least 6 months. And secondly, how well the current vaccine works against all these variants that keep popping up. We also don't know that.
When the flu hit the first time in the 1920s,
Mhm.
and it's morphed into 100 years later this kind of, okay, well, if you get it, it's bad, it's annoying. Is this, I mean, 100 years from now, is COVID going to look similar to that, or is this something completely different than the pandemic from the 1920s?
A lot of people die from the flu. So we sort of take it for granted, but a whole lot of folks die from the flu. Even some young people die from the flu. So it's not a ho-hum disease, and vaccination is important. Most people don't die from the flu. Most people don't die from COVID either. COVID is currently more fatal than influenza, and we don't know what trend that will take. Typically, viral illnesses like this over time become less virulent, meaning it kills fewer people. That's partly due because people have a certain amount of immunity. You may remember a few years ago there was a particularly severe flu, and older people and young people were particularly affected, and that is because older people have some immunity from previous iterations. So even though the flu mutates every year and we don't know, it's similar from some past years, and some older people have some retained immunity from those older years. So that particular flu, which was about 4 years ago, young people were particularly sick. You may have remembered in the news there were young people dying, and it was pretty terrible. So nobody knows, and my guess is COVID very well may become like influenza. I've even had this fantasy that maybe we'll get our COVID and our flu shot in one needle every year.
And what do you think the medical profession and well, the world in general, I suppose, has learned from this pandemic, and how do we apply that knowledge?
Part of me is really kind of pessimistic because that we've learned anything, because we made many of the same mistakes we made during the influenza pandemic 100 years ago, and that's kind of depressing. We have learned that pandemic preparedness is really important because you never know when the next pandemic is going to show up. So we have to be prepared. We've also learned that an emergency like a pandemic makes racial, ethnic, and economic disparities painfully obvious. And despite much lip service that corporations, public officials, and health providers have given to systemic racism, both the testing process and the vaccine rollout showed us not a lot of fundamental change in these systems. So, and the fact that the nation dropped most pandemic restrictions while significant vaccination disparities remain is a demonstration of, I have to say, white privilege.
So going forward, this could happen again in
It will happen again. It will happen. It's if you look back through history, there have been pandemics throughout history. The fact that we went 100 years without one of this global proportion, well, we were really lucky. Speaking of the inequities, and particularly in the Massachusetts, Greater Boston area, well, even nationally, white people are 50% more likely to be vaccinated compared to Black and Latinx people. And that's true for the whole United States, and it's absolutely true for Massachusetts. In Massachusetts, 62% of white people are vaccinated, but only 46% of Black people and only 40% of Latinx people are vaccinated. And you might ask how that happened. Early reports blamed vaccine hesitancy, but actually, if you look at hesitancy, Black and Latinx people, it's average compared to the rest of the United States. So systemic racism has worked in many insidious ways to obstruct access to the vaccine and to testing before that. So early on for the vaccine, you needed a good computer system, you needed internet, you needed a lot of free time to make an appointment, you needed a decent car to drive out to the mass vaccination site, you needed the kind of job that would give you the time off to go get your vaccine, you needed to not be scared of the National Guard troops in their uniforms giving out the vaccine. You needed to feel that the place where the vaccine was being given was a comfortable place for people like you. You would want to see people who look like you there. And some of the obstacles are decreasing now because there's been more emphasis on community-based vaccination sites sponsored by pharmacies and clinics and churches, and even being promoted in places like hairdressers and barbershops. So I'm hopeful that these disparities can decrease over time.
And it's fascinating because you forget there are people who are out there that don't have internet access and don't have the time to sit and try to get one of these appointments early on.
Oh, really? I have to tell you that, my husband was part of that. I got my vaccine because I'm a healthcare worker. But when he became eligible, the two of us spent 10 person hours on the internet refreshing to get him his appointment. I mean, who can do that? I mean, we're privileged, we can do that, but most people can't do that.
With the numbers dropping, I worry, are people going to say, well, I really don't have to get this vaccine because the numbers are so low, it's not going to affect me anyway.
That is a danger. It is.
We would like to thank Dr. Michelle Holmes for joining us this month and providing important information about the COVID-19 coronavirus vaccines and how they will impact school sessions when school begins next academic year in September. If you have any questions, comments, or an idea for our future podcast, please navigate to our website, jfynet.org, which also features a wealth of commentary, dialogue, and free scholastic resources, including this monthly podcast, to support all educational communities. Thank you for joining us. For JFY Networks, I'm Greg Cunningham.